Wellbeing Board. I'm Peter McCabe, I'm the chair of the Health and Wellbeing Board. I'm going to skip going around and ask them to introduce themselves because we have a very busy agenda. And on that note, if I can ask everyone to be disciplined in terms of their questions, their presentations, their comments, and so on. We find ourselves short of time. And this meeting is being live streamed, as you will see. And so everyone's aware of that, and you have consented to remaining in the room. So item 1 is apologies for absence. Any other? Josh Caroline is from. Karen is joining. Karen is a member. She's joining on. Welcome, Karen. I hope you hear us, and I hope I can hear. And John. So you can hear us. Good. So item 2 is declarations of interest. Are there any declarations of interest? Right. Item 3 is the minutes of the previous meeting. They have been circulated. Are you content for me to sign these as an accurate record of the meeting? Move on to the agenda, and that's item 4, which is focus on prevention actions and actions overview dashboard indicators. Russell, you're going to introduce this, and you'll be to explain their bit of the
yeah, I'll go along. Yeah.
Thank you.
So the health and wellbeing tonight is dedicated to focus on the prevention priority, which I'm SRO for the board. This is the second theme of the new strategy for 2023. At the September board, we focused on Start Strong priorities. I was able to give a brief précis of the prevention work at the end of the September board. This is the first time we've had a dedicated meeting focusing on prevention priorities. And I include colleagues from Public Health, Adult Social Care and ICB on prevention items in the strategy. Very pleased to be able to bring a breadth of updates tonight to board and insights across the prevention work stream. The aims of the priority are to invest in proactive measures to prevent illness and promote health and well-being at every stage of life, so everyone can thrive. Utilising the actions outlined in the strategy, this drives our collective efforts to help keep Merton residents well and get more upstream to help prevent problems before they start. We have 6 actions within this theme. Briefly, these are action 1 is implementing preventative approaches within the revised Merton Local Health and Care Plan. Action 2 is addressing behavioural risk factors. Action 3 is maintaining a multi-agency approach to tackling the harms of alcohol and other drugs. Action 4 is around working with communities to raise awareness around immunisation and vaccinations. Action 5 is renewed efforts in MEC, making every contact count. And Action 6 is work in partnership to prevent, reduce and delay the need for adult social care. So in terms of the rhythm of the updates today, we will start with the brief updates that are contained within the first paper in the pack. I will provide a summary of actions 4 vaccinations and 5 MEC short updates. I'll then hand over to Mark to cover action 1, assuming Mark arrives. And then Terry Clark will speak to action 6, which is the prevention in adult social care action. So, and to finish this item, Chair, Samina will then briefly talk through the data in terms of the outcome dashboard for the focus on prevention. Then in terms of the more detailed updates under this theme, they will follow the safeguarding report items that colleagues are bringing. We'll then come back to prevention actions that have the more in-depth updates. And that's action 2, in terms of risk factors. So Louise will introduce this and Julie will lead the item. Action 3, Louise will introduce, Ted will lead the item. And finally, there's a lift and experience and voice item, which comes near the end of the agenda, which provides a segue from our prevention theme into theme 3, which is stronger communities, which is the next theme for board in January. That will kind of tee up Tony's item at the end. And in terms of the lived experience and voice, Louise will introduce again, and Izzy and Nicola will lead us through it. So for the 2 brief update items I will cover, the first one is action 4, raise awareness of the benefits of vaccinations. So a reminder for board, the immunisation programmes are commissioned and delivered by the NHS, the local authority, through the Director of Public Health as an assurance role. To help deliver this assurance, there's a multi-agency Merton immunisation committee in place, which is responsible for ensuring the delivery of the Merton IMS action plan, which was updated in July 2025, and a new accompanying IMS comms plan. The role of LBM in raising awareness is to support South West London ICB's work, including to reach communities with low uptake, share and amplify national and local comms, ensure that translated digital and print materials are available across our borough, ensure that staff in services are informed about the IMS programmes, and encourage LBM staff to take up vaccinations which they're eligible for. In terms of progress, just briefly, grants have been awarded to community organisations to run engagement programmes. Insights from these have fed into the South West London ICB and our Merton immunisations plans. We have developed tailored media assets featuring some of our own community members and leaders. And Merton Connected ran an outreach programme for Black African and Black Caribbean communities who have lower IMS uptake rates, and the insights from this will inform further targeted engagement. And looking forward, the focus is on the continued delivery of the national immunisation strategy, with an emphasis on the delivery of the London IMS plan tailored to the needs of Merton residents. Moving on to action 5, which is to commit to prevention being everyone's business, with renewed efforts around making every contact count. So MEC in Health and Care is an established initiative that encourages health and care workers in particular to engage with individuals during routine interactions to promote health behaviour change, and also, where appropriate, refer on to support services. So progress, a task and finish group has been established with commitment from all partners. That includes Council, ICB and VCS on both the objectives and the scope. There's been work to review and update the MEC Link website. Training's been delivered by Public Health, the Merton Public Health Commission Service, Everyone Health Service for Age UK. This has generated insights that will be taken forward. Existing MEC training has been mapped, and where gaps have been identified, this has informed future opportunities. And South West London ICB are continuing to promote Get You Better app, a digital app that empowers residents to manage common MSK conditions independently, and women's pelvic health. So looking forward, many actions will be completed within year one of our strategy, and it's likely further actions will fall out as a result of the work to ensure there's a refreshed commitment to MEC in the longer term. So I'll stop there, Chair. I note that Mark's not arrived yet, so I don't know if Terry's happy to take his item first, item 6, in the hope that Mark will then arrive.
I've messaged Mark to see if he is en route, and I haven't heard back yet. So Terry, if you wouldn't mind, that would be helpful.
Absolutely fine. So action 6 is about working in partnership to prevent, reduce and delay the need for adult social care. Members of the board will be aware that that is a core element of the Care Act and the work that we do in adult social care every day. So just a couple of things to highlight over the past 6 to 7 months. A significant amount of work has been done to support carers across the borough. We've held our inaugural Carers Congress, which brought together all of our carers group to listen and learn from them. And Councillor McCabe, you were able to chair that meeting, and further work will continue over the coming year. We've extended our Civic Pride Funds, so that's the investment into the voluntary sector to continue to support residents across the borough to the end of 26-27, which will have a key impact on our prevent, reduce, delay work. And we've also this year, for the first time, ring-fenced some funding within the Household Support Fund for carers, which hasn't happened before as well. Looking ahead, we've just started to pilot our community re-ablement service, which will support us to support residents in the community to be re-abled rather than needing to come in and access adult social care, so a home care package or more complex care, which will keep them in the communities. And we'll be continuing to work on that over the next 6 months. We've also just launched, and I think it might have just closed, Tony, our small grants program tomorrow. There we go, closing shortly. Small grants program, investing further into grassroots voluntary sector organisations to support local communities. There's much more in the highlight report there, but I'm happy to take questions when we get to the end of the item.
Mark, we just skipped on to Terry in the hope that you would arrive, and the 7th Cavalry has turned up, so welcome. And you're going to talk about action 1, embedding prevention. And
so firstly, apologies for being late. There's some roadworks which I'll talk to you about later. Which
you don't need to tell
me completely.
You don't need to tell any of us who live in the borough about roadworks.
Yeah, it was a slight challenge that I didn't anticipate. But anyway, so just in terms of action 1, obviously working with kind of our public health colleagues, it's really important that we embed prevention in all that we do. Now, we will know that the ICB is going through significant change. And what we've had previously was a health and care plan. So we want to ensure that the health and wellbeing strategy and the health and care plan going forward are completely aligned, and prevention is one of the 3 shifts in the 10-year plan. So absolutely keeping that focus. What we want to do is also share the metrics so that actually we are working to the same kind of aims and ambitions across health and social care. Because what we can do is we end up with 95 different metrics, and we're all off in our silos working in different ways. We want to combine that so that actually we've got, this is what a true mark of success is in our local work. To complicate matters, the 10-year plan also talks about a neighbourhood health plan. And as I'm talking, how many times have I said the word plan? Yeah. What we want to make sure is that from the health and wellbeing strategy, we have local neighbourhood plans and a local health and care plan that all triangulate and align. Yeah. So that's the piece of work that we're kind of starting to embark on. We had a really great session yesterday with our adult social care and local authority partners, just in terms of how we kind of structure that neighbourhood development, but absolutely making sure that prevention is part of front and centre in terms of how we move forward.
Mark, and Samina, you're going to come in next.
Yeah, thank you, Chair. Yes, I'll just wait for the dashboard to come up. Thank you, Megan. Okay, so I'm going to be talking about the prevention part of the dashboard. So for the prevention part of the strategy, we have 5 measures that we track regularly. As one of them is establish a streamlined approach to prevention across the health and social care system, voluntary sector and all other council services, we don't report anything on it at the moment. The plan is to do this in the future. So the second measure we've got is the prevention measure on obesity prevalence in adults, which is associated with reduced life expectancy and is a risk factor for a range of chronic diseases, which we want to see reduce. The most recent prevalence figure is 1 in 5 adults are obese in Merton. And this is very similar to the previous year in Merton, and percentages are similar, as you can see, to South West London and London. Trends have remained lower in Merton compared to England for almost a decade. Adult obesity is linked to the Year 1 action in the Health and Wellbeing strategy on place a strong emphasis on addressing behavioural risk factors like smoking, poor diet, alcohol use and physical inactivity, while promoting mental well-being. The next measure is the substance misuse measure on the number of new presentations to treatment for substance misuse, which is one we want to see an increase in residents accessing Merton specialist services, especially women and those from LGBTQIA+ communities. But trends have been decreasing in Merton since 2021. As this is a measure based on numbers, it isn't possible to make comparisons to London and England. Substance misuse is linked to the Year 1 action in the Health and Wellbeing strategy on maintain a multi-agency approach to preventing and tackling the physical, mental and societal harm caused by alcohol and other drugs through delivering on the action set out in the 2024-2025 Annual Public Health Report, Tackling Drugs Together. Then we have the prevention measure on vaccination coverage for MMR 2 doses in the bottom left. And that's one we want to see increase. And generally, trends have been increasing steadily since 2017-18 and are fairly stable, but not as high as we would like. Uptake is similar to South West London and London, but lower than England. Vaccination coverage for MMR is linked to the Year 1 action in the Health and Wellbeing strategy on work with communities and across the health and social care system to raise awareness of the benefits of vaccinations to our residents, focusing on those who are vulnerable, those at higher risk of serious disease or death, and groups that face health inequalities. Then we have the smoking prevalence in those who have long-term mental health conditions compared to the general population in Merton. And this is a closing the gap measure where we are hoping rates will reduce in those smoking with a long-term mental health condition to be the same as the rest of the population. However, we can see a mixed picture and each year the data fluctuates. And the latest data point here shows that the gap has actually become wider. This measure is linked to the Year 1 action plan in the Health and Wellbeing strategy on place a strong emphasis on addressing behavioural risk factors like smoking, poor diet, alcohol use and physical inactivity while promoting mental well-being. Thank you.
Thank you. So are there any And any comments you'd like to add, Russell?
No, no further comments, Chair. I noted John had his hand up.
I'm glad you did that. John, you'd like to?
Oh, just very quickly, I just wanted to thank everyone for the presentations. It was a really interesting presentation. For Samina, I was just interested in one of the final things you said, and it was about people with mental health issues and smoking. What can the partnership do more to try and work with public health to resolve that? Because it's really worrying for me that the numbers have increased.
Thank you, John. I think I'm going to hand over to one of our leads in the team, perhaps to Ted or Barry.
I think, Chair, it will be picked up later in one of the items that we're coming to. There's an item on that includes smoking.
Okay, can we come back to it at that point, John? Okay. Has anyone got any questions about the initial presentation, bearing in mind that we're kind of returning to this later in the agenda? Jennifer? Well, could you put your mic on? Sorry, because I mean, if they are specifically about the issues that are going to involve a deeper dive, then I think you should hold them. If they are about the general issues that we've
just some points of clarification on some of the action.
Thank you. Anyone else want to ask any questions or make any comments? Okay, well there will be an opportunity to ask those questions. I mean, with Samina's graph, the wiggly one, which demonstrated, and that was the point that John was making. I'd like to come back to that at a later stage as well, so we can make a note of that. Okay, anyone else want to add anything? Okay, well in that case we will move on to item 5, which is the joint pharmaceutical needs assessment, and Barry is going to introduce this briefly.
Thank you, Councillor McCabe. So, colleagues, the Health and Wellbeing Board has received a number of papers over the last kind of 9 months on the pharmaceutical needs assessment. And if you remember, the pharmaceutical needs assessment is used for market entry purposes by the NHS. So if you remember, we worked really closely with our local authority colleagues across South West London to commission an expert provider of pharmaceutical needs assessment. So through that process, we saved a small amount of funding, but we also secured a far more robust methodology because we had 6 public health people around the table making sure that all those P&As that we developed were as robust as they need to be for market entry purposes. Excuse me. You'll remember that the process included significant resident engagement, and we had 313 responses to that. So incredibly grateful for colleagues for sharing that, including our Health Watch colleagues who supported increasing the reach of that survey. We also included which was in the statute, a 60-day consultation on the draft P&A, which you remember seeing previously. And so at the June Health and Wellbeing Board, you agreed to delegate to delegate the final approval of the Merton Pharmaceutical Needs Assessment to Russell as our DPH and Councillor McCabe as the Chair of the Health and Wellbeing Board. So the conclusions that we have published within the final pharmaceutical needs assessment are that there are no gaps in pharmaceutical needs within Merton, and that the current needs are being met by the current providers. So the the full P&A has been published, all 136 pages of that. So we will include the link to the P&A in the notes so everyone can see a copy of that document. So we have now moved into the maintenance phase, because clearly community pharmacies might move location, they might change ownership, they might close, because we know of the significant challenges that pharmacies have across the country. So we're now working through the process to make sure that the P&A remains up to date, and if we need to, we might publish supplementary statements. But a huge thank you to the Health and Wellbeing Board for supporting the development of what is a compliant, strong and effective pharmaceutical needs assessment. So I shall hand back to Councillor McCabe.
Thank you for being so succinct, Barry, and we note the pharmaceutical needs assessment and move on to item 6, which is the Merton Safeguarding Children's annual report. Justin, you're going to introduce this item.
Michael. So yes, so this is the Safeguarding Children's Partnership Report, Annual Report 24-25. That's here for information. The annual report is a requirement under the Working Together and also under the Children's Social Work Act as well. We've had quite a few sort of significant changes across that period of time. So we have Bev started within just recently within that period of time. We also had change in terms of police representation. So Steve Todd represents the police in the exec, and also Aileen sort of stepped down as part of the independent chair and a part of the changing in terms of the working together arrangements, which then made that the partners rotate the chairing, hence the reason why I am here. So at the moment I'm chairing the Safeguarding Children's Partnership. The report itself outlines our priorities and sort of key themes. There's a bit of an oversight in terms of data, so you can sort of see the changes in terms of children in need and also child protection as well, and a sort of slight increase in those rates. It outlines in terms of the governance as well that we have from a safeguarding perspective, and also in terms of the scrutiny and scrutiny arrangements, which, as I think your recent Ofsted inspection highlighted, is really strong within Merton and sort of provide some sort of good outcomes. There's a bit of an update in terms of JTI, in terms of the action plan around the serious youth violence, and also the work that we've done jointly with the Adults Board as well. And clearly we've done a work in terms of the conference and a range of different things in terms of sort of the think family sort of approach. And one of the key priorities as well is around the children's social care reforms. So in terms of sort of family first sort of work that we're sort of undertaking. And I think the only other one that I'd sort of highlight is clearly from our reviews. We had the VAMP review, so there's details within there, and a lot of our priorities in terms of difficult conversations and engagement has come out from that review. So in terms of how we engage with children and young people better, how we ensure that our services are geared around that, and how we sort of make sure that that services are approachable and easy to access. So in terms of our priorities, we have early help, mental health and well-being, contextual safeguarding, domestic abuse and neglect, and those sort of continue through. And I think that as the scrutineers have put, I think that the report reflects that Merton has maintained a really strong partnership. It's a very mature and strong partnership, and actually there's a real commitment to making sure that the children and young people within Merton are safe. Happy to answer any questions that there may be.
Thank you. Bev, would you like to add anything to what Justin's had to say? We've also got Sarah from Children, Lifelong Learning and Families Online. Anything from you, Bev?
Chair, I do think that Justin, our independent chair, has set out an accurate summary of the contents of the report.
Thank you. Sarah, is there anything you'd like to say or add?
No, so in agreement with that as well. Thank you.
Councillor Kawesi, anything that you would like to raise or add?
Thank you very much, Chair. Yes, there is something I'd like to add, but I'd like to begin by just endorsing everything Justin has said over the past year from my involvement with the partnership. I've seen it take on the learnings from reviews, and those reviews have formed a significant amount of our workload, which speaks to what Justin was saying around having a mature board that learns from the experiences of our children and young people and uses it to shape our work. And one particular area of work that I wanted to highlight, which also speaks to the innovation on the board, which I really appreciate in terms of foreseeing future safeguarding concerns for our children and young people, is the work around better get this right, the children and adolescents to parent harmful behaviour, which is an area that we were able to get funding from the violence reduction unit, looking at child to parent abuse, which can contribute to separating families, and so feeding into our keeping families together work. And it's a really innovative piece of work, and speaks to the kind of innovation on the board. And I cannot be more thankful to the partners and to Justin's leadership on the board. It's a really good report, and I hope everyone's had the chance to read it, or does take the time to read it, because there's a lot of good work in there, along with the ongoing challenges which are well outlined in our priorities. Thank you.
Thank you, Councillor. So it's Nicola.
So hello everyone and good evening. I'm Nicola. I'm one of the Public Health Young Inspectors, and my question is coming from a youth-friendly perspective. So I wanted to ask, were young residents formal partners in overall developing the strategy, and if not, why? And could it be an opportunity that could be looked for in the future to help so young people can help co-design the next year's safeguarding priorities and review the progress as it goes along? And also, was there any plan to, in future, create an easy read version of the document? And also another question I would like to ask is, were the young people who took part in the focus groups informed that their contributions were meaningful and helped to shape a Safeguarding Children's annual report?
Thank you. Good questions. So we have in Beth, we have a young scrutineer who's part of all of the sort of safeguarding elements, and actually she's often part of our executive meetings as well as sort of other meetings. And we also have Sarah, who does the sort of the independent scrutiny work. So there is a sort of infrastructure around in terms of actually making sure that children and young people's voices are heard throughout all of our scrutiny work, and in terms of setting the priorities. So yes, there has been that sort of involvement, engagement in terms of setting priorities. In terms of an easier read, I think, I mean, I'll look to Sarah on the screen, but I think we do have something in plan, and I think that there is a sort of signed off sort of a report for that, so it is more accessible, and the young scrutineers have been involved in developing that as well. So there is, you can really hear the voice, and I think that through the Ofsted sort of inspection as well, you can really see the voice of the children and young people throughout all of the safeguarding work, and it's very much sort of driven by that. So in terms of priority setting, in terms of what we're delivering, and the scrutiny work in terms of things like even the neglect toolkit, there's been a real sort of analysis around that. What does it mean for children and young people? What does it mean for parents? So that sort of research and sort of looking at going deeper into what actually, how does we put things into practice, and what does it mean for children and young people going forward? So yeah, absolutely. Thank you.
Thank you, Justin. Sam.
And if I could add, Chair, to Justin's answer, one of the pieces of work that our independent scrutineers are doing, which of course does include our young scrutiny, is around the accessibility of services to our children and young people, and any barriers that mean a child or young person may fall into the category of what some call hard to reach, which is a very unhelpful term, but they're doing a piece of work on that and speaking to groups of children and young people, well, trying to speak to as many as they can, and that in itself has been a bit of a barrier. And so if you feel there are voices that could be involved in that work that haven't currently been engaged, then we can look at potentially connecting you with Sarah and Beth for that piece of work that they're doing. And that was also the central focus of the conference that we had recently in partnership with adults, because of course there are some adults that feel not as involved in our processes as they could be, then we can definitely connect you with Beth and Sarah, so you can be involved in that piece of work, and we can make sure the voices of all of our young people that want to be involved and are willing to be involved get to express their voice in our safeguarding processes.
Thank you. Any other?
Thank you, Chair. Just a couple of points to raise. Thank you very much for the report. In the report, it says that 47,076 children and young people living in Merton, 27,620 are in school for full-time education. It doesn't highlight where the remaining 42.3% are. How many are employed and not employed? Because the number of the NEETs is on the rise. I'm just wondering if you could clarify, add a little bit more information there. And just to pick up on a slight error in the report, it says under the section where it says the number of children subject to a child protection plan increased from 138 to 155 within the same period. And so this is a slight error because the number has decreased. Not there's a pick up on that. And yeah, I think if you can just clarify the first question, thank you.
So I'll respond to the last bit. Yes, there's just it's a typo. It should be increase. So in that rather than decrease, reflecting obviously the increase in terms of the rate. I probably am not the best person to answer the question in terms of the NEET and in terms of that element. I don't know whether anybody else would be able to answer that.
I can come in. We can find out that information. I think there would be a lot of preschool age children in that total number, and we can find out the numbers not in education and share that if that's helpful.
You had your hand up anyway, Sarah, so would you like to speak on the issue that you identified earlier?
Yes, so it was just to add into the response to young Inspector Nicola's question just around the meaningful engagement with young people. I wanted to add that some of the work that our scrutineers do that Justin mentioned, so Sarah, the independent scrutineer, and Beth, our young scrutineer, they've also created easy read documents of their findings and what the partnership are doing in response that they take back to children and parents and carers to share what the partnership's actually done after they've held focus groups and fed back to us their views. And the other point on that is the learning reviews. We always make sure that we encourage families and the young people involved in them to speak with us if possible, and if they're willing to make sure that their voice is really clearly heard in that process as well.
Thank you. Bev, you've got your hand up.
Thank you, Chair. I just wanted to come back on our young inspectors' encouragement to just articulate how well the priorities set by the multi-agency safeguarding partnership last year, and again the new priorities were shaped by children and young people. I feel it's important just to say that the priorities were shaped based on the lived experience of children in Merton and articulated through the practitioners that work with them very closely, through our schools, through the data and insight from the data, through the feedback that we often get from families and children about the areas that they feel are the safeguarding issues that they are part of their experience in the borough. So it's far broader than individualised inspectors and participation workers. We try right across the system to ensure that anyone that is accessing services has the opportunity to share with us their lived experience, and that informs the way we develop and design our services.
Thank you. Are there any other comments or questions? In that case, can we note the report and we can record that we have commented on it as per the recommendations in the report. So thank you very much, Justin. We appreciate your contribution to that important work.
Just say thank you to the whole safeguarding team, because it is a partnership piece of work, so thank you.
Of course. So item 7 is the Merton Safeguarding Adults Board Annual Report, and Aileen, you're going to introduce this.
Thank you, Councillor McCabe. This report for 24-25 is the first of our new 3-year strategy. Now, we set priorities which came together from a number of different kind of sources, and we looked at individual organisations and what they felt their own safeguarding learning had been, and where they felt their direction of travel was, and what they had learned, and very similar to children's from the kind of lived experience of those who draw on care and support and wider health services. We actually took the decision as a partnership to retain the same priorities as we'd had previously, and that wasn't because people weren't full of ideas about where we needed to kind of direct our annual attention, but overall, strategically, they still seemed like the right objectives to maintain. And certainly one of our kind of, there are 4 principles, there are 4 kind of priorities that shape what we do. And the first one is prevention and early intervention, and fits very well with the conversation that you were having earlier as a health and wellbeing board. And we're very aware too that as we move forward into the kind of new neighbourhood working and the kind of joint working, what Mark was talking about the various plans, we very much see safeguarding as being a key feature of prevention and intervention. And over that last year, what we have done is some work as a partnership as a whole. We have looked at kind of complex cases. We did some particular work about young mothers who we came across a number of cases of young mothers who've been subjected to domestic abuse, who were finding it difficult to engage with services because they were very often moving around, and looking at the complexity that meant for those young women and what we could do to work differently. So some work we've done as a board, and some is the work of kind of individual organisations that adds to our kind of preventative picture. So I'm thinking in particular of the public health work on suicide prevention, which gives us a kind of foundation in this work, and also that Terry talked about earlier about the civic pride grants with adult social care, so that we can begin to focus on recognising early how we keep people safe and free from harm in a kind of preventative way. But it has to work alongside all of the kind of partner organisations. Our second priority is, and we have always had this priority of making safeguarding personal, and this is about making sure that people's individual stories are respected, and that we kind of learn from their lived experience, but that they also feel that what we kind of undertake in terms of a safeguarding review actually results in the outcomes that they wish to see happen, so that they too are kind of part of that process. and we have particularly focused on mental capacity for those people where it's more difficult to assess the capacity of somebody to make decisions and executive kind of functioning within their lives, and to make sure that we don't make assumptions, and that we do, in the safeguarding context, make sure that safeguarding is still personal. And we have published one SAR during that year of 24-25 where there was a real emphasis on learning of the lived experience, and that was the case of Beatrice, and together with the In Children's, the case of Mem. That was the subject of the conference that we had last week when we brought staff together to talk about difficult relationships and what that meant for frontline staff. And our third priority is building and strengthening communities. This is incredibly important to us. It gets the safeguarding message out there throughout Merton, and we have the community champions who are in touch with a whole number of voluntary sector organisations and feed back to us what concerns there are in local communities, so that we get a diversity of understanding and views of what are the kind of concerns that people have in terms of their own safety. And the last priority is our whole quality assurance, to make sure that we are constantly looking and holding to account services in terms of their outcomes, their safeguarding outcomes. And part of that is obviously our data collection. The number of referrals has gone up during that year, but that's not surprising, because overall the number of referrals in adult social care has also gone up. So you would expect that to reflect in safeguarding concerns. And the data, I won't go through it all in detail because I know you're very short of time, but the data is outlined in the report. And I'm very happy to answer any questions, Chair.
Thank you, Aileen. John, would you like to add anything to what Aileen has had to say?
Nothing to add, Chair. I mean, I'll just make a wee comment. I mean, I'd just like to thank Aileen. We're very lucky. I know as the Director of Adult Social Care, I'm very lucky to have such an experienced independent chair who's been a director in adult social care herself for decades more than me. So just thank you, Aileen, for all the work you do in Merton.
Taking the words out of my mouth, John. But I too recognise how fortunate we are to have Aileen and her experience and expertise available to us. And I was wondering, John, if you wanted to talk about the CQC remarks about safeguarding.
Well, I mean, not to add, but I mean, we're very fortunate that with lots of work from the teams, we got a rating of good, as the board is aware. One of our strongest areas was safeguarding, and we were pretty close to outstanding for safeguarding in the report, which is something that I'm incredibly proud of. It's a lot thanks to Aileen and the work of the board, but also to our frontline staff, who really work hard protecting our vulnerable adults on a daily basis.
I think that was the reason why I was asking you to comment on that, John, because I think for people who are not as close to it as you and I think that provides a measure of reassurance when they hear that independent people have been looking at what we are doing and the quality of that work and are making the very positive findings that they've reached. So are there any questions? Jennifer?
Thank you, Chair, and thank you very much again for your report. Just a quick question, really. Modern slavery is not mentioned throughout the report, only cited on, I think, page 104. Is that a positive reason for that?
Yes, there are growing numbers of concerns about modern slavery, and we are actually doing some work in this current year in relation to that. But during the year in question in the annual report, it's relatively small, but that doesn't mean to say that we shouldn't keep a focus on it, which is why it's mentioned, and we will continue to do so. I mean, I think the world of how we understand safeguarding and the kind of harm and abuse that people are subjected to is changing. The context is changing, and we need to be really aware of that and respond appropriately. So it might be a small mention, but that doesn't mean to say that it's not very much in our sight.
Are there any other questions? Barry?
Thank you. And as Aileen mentioned, suicide prevention, I think I should give an update on suicide prevention too. So as the Health and Wellbeing Board will remember, we presented a suicide prevention action plan for the borough a few meetings ago. We are still delivering on the actions related to that, and that's absolutely joint work with the voluntary and community sector within the borough and with the ICB. Really important, those partnerships. But on Monday at 2 p.m, we have our suicide prevention forum, which is an open invite for those organisations and individuals who wish to contribute towards suicide prevention, making suicide prevention everybody's business. So that's very much a piece of work led by us in public health, chaired by myself and Keith Shipman in Bev's team. So yes, Monday at 2 p.m, suicide prevention forum, if anybody would like to take part.
Thank you, Barry. Any other questions or comments from any of the members of the board? Okay. Well, in that case, can we note the report and in doing so acknowledge that we've commented on it as required within the recommendations of the report? So thank you very much, Aileen, and
Thank you, Chair.
we appreciate all your efforts. So item 8 is going back to what we were talking about, Russell introduced at the beginning, and that is to have a bit of a deeper dive in terms of placing a strong emphasis on addressing behavioural risk factors, focus on equity and services and support those at higher risk of poor health, and that will be led by Louise and Julie. So over to you.
Thank you. Good evening, everybody. So yeah, this paper, which is focusing on addressing those behavioural risk factors, is really focused on moving actions more upstream to primary prevention and stopping the start of lifestyle-related ill health. We've structured the paper to give a brief overview of current prevalence and outcomes data in the first year of the strategy delivery as part of that look-back approach. Better. Thank you. So we're looking at the data as part of that look back approach. Where are we now? We know you've read the paper, so we're not going to cover that data in detail. The paper then goes on to describe the actions being taken by partners against this action, structured through 3 themes: offering choice, listening to residents' voice through their lived experience, and working in partnership. We've chosen those themes to reflect some of the health and wellbeing principles that's underlying the strategy, such as being community-centred, listening and learning from experience, and that system-wide alignment working together to deliver a unified vision. The paper highlights the range of services and activities available across the borough to support people to change their lifestyle behaviours, but remembering too that our environment, where we live, our income, our education, access to green space, etc., all plays a big part in being able to adopt those healthier lifestyles. So I'll hand you over to my colleague Julie Kelsey, Health Improvement Officer in Public Health Team, to take you through the Action 2 paper.
Thank you. So as Louise has said, for this presentation, we'd like to just focus on the how through choice, voice and partnership. So just to start with choice, and I'm going to talk about some smoking work that we've been doing. Just a reminder that there's approximately 23,000 people who smoke in the borough. And over the past year, we've expanded the breadth and depth of stop smoking services available through use of the additional local stop smoking services support fund grant that we receive from the government, which is just under £300,000 per year. That's over 5 years until 2029, and we're currently in year 2. So what we've done is we've created a single point of access website, which is Smoke Free Merton, that brings together the jigsaw of services and additional supporting information. We've moved from a robust and successful tiered stop smoking service that was previously delivered by the previous provider, 1U Merton, to a universal offer And that includes, we've recommissioned the Healthy Lifestyle Service with a 7-year contract given to Everyone Health, who deliver the more traditional 12-week stop smoking service. And Everyone Health also oversee the Swap to Stop service, which is where we use vape kits as a for harm reduction to support people to give up on tobacco products. We've also commissioned licenses for the Smoke-Free app, which offers 24/7 digital support with access to free NRT or vape kits delivered directly to people's homes. And we've also been running a pilot for Alan Carr's Easy Way, which is a nice recommended drug-free stop smoking service using CBT and psychological techniques to help stop smoking. In addition, we offer culturally appropriate stop smoking resources, particularly aimed for those of Eastern European heritage and for our LGBTQ+ communities. We are starting to see some of the outcomes from that additional investment of services, and our Q1 year-on-year set quit dates actually were up 70% against the previous year. Okay. We've been able to continue to support smoking in pregnancy, and next week is actually Smoking in Pregnancy Awareness Week, and that's along with our colleagues with the ICB. And also, while we want to support people to give up smoking, we also want to stop the start and ensure that children and young people aren't taking up smoking through the investment with Catch 22, the Risk and Resilience Service, to help to deliver a preventative information and support service that's aimed at young people, parents, carers and educators. Just moving on to Healthy Way, and just a reminder that over 100,000 people in the borough are classed as either overweight or obese. And what we've been doing is transitioning to an all ages eat well and be active with a steering group and an action plan, which is currently in progress, with a focus on the underlying causes of healthy behaviours. We've detailed the choice of services that are able to support people in the paper through Family Start, CAMS, Everyone Health, and a range of adult diabetes prevention, and also supporting those with a diagnosis of diabetes, and all the way through to the specialist weight management services, which is run out of St George's, which includes access to the weight loss medications. We've also given residents increased choice for healthy eating options by reducing fast food takeaways not being able to be within 400 metres of schools, and a restriction on the numbers in areas where there are already a high number of fast food premises. When it comes to physical activity, there's a range of offers to complement the comprehensive offer from leisure providers and through the borough sport. For example, the refurb of the programme for parks, courts, and the increase in the number of outdoor gyms. And also we've got Merton Moves for older people, Feel Good Folders, which is a motivational resource from the Alzheimer's Society for people affected by dementia. And we've also got MotiView exercise bikes, which are located in care homes. So when we talk about the voice area of this presentation and the lived experience from Seldom Heard Voice, there's a couple of examples that I'd like to use. One is that we worked in partnership with other South West London local authorities and commissioned Westco Communications to deliver a suite of communication and marketing resources around stop smoking services to promote smoke-free Merton. And some of you have a coaster near you, which is one of the resources that Barry is happily showing you there, which is one of the resources which has gone out particularly to primary care, so that GPs and nurses can have that on their desk. If they're talking to somebody, they can just use it there and then to go, here's the QR code, off you go, hopefully. Part of that process though with Westco was that they delivered 2 World Cafe events for us, which is a qualitative engagement methodology delivered in an informal setting. Everyone who attended was someone who was a smoker, and they were a South West London resident. And the rich conversations helped to inform the messaging and the style of the marketing resources, using also behavioural science, so the combi of that capability, opportunity, motivation, leading to behaviour change. And this piece of work that we did with Westco was showcased as an OHID national stop smoking webinar as an example of good practice. On the Healthy Way part of Voice, we've been hearing from local voice with colleagues from the South West London ICB. They launched a small grants programme around community conversations for local grassroots organisations to share their thoughts on what healthy weight, keeping active and access to weight management services. And the public health team supported through the grant bidding process and worked in partnership with a successful organisation. And just throughout the paper, we give examples of where we have been working in partnership across not just South West London local authorities and in partnership with the ICB, but also we've been working across our own work streams in public health, combining smoking, alcohol and CKD, so chronic kidney disease prevention work, by supporting running a small community grants programme. The focus was using local diverse community experts who best understood their own communities with their needs, cultures and barriers to accessing mainstream services. And while we wanted to promote the healthier lifestyles, the benefit of the small grants programme has been about establishing positive partnership working with each of these organisations where we might not have worked with them previously, and also valuing the work of the community groups with a properly funded and structured grants programme. There were only small grants from £3,000 up to £15,000, but it also gave them the balance to offer them to be innovative and creative within a framework of some suggested outcomes. And they're just coming to the end of their final reports at the moment. We haven't collated all of that. Izzy has been helping me with that as well, but they're looking very positive on some of the outcomes, and that will help to shape the future direction of sustainable service delivery for healthy lifestyle services. If anyone's got any questions.
Thank you.
And we will also, we'll talk about your mental health smoking question in a minute if you want, but if you've got other questions then.
Well, do you want to, I mean, John raised the issue, so why not deal with that now, and then we can ask members for any other. I know Jennifer's got some.
Yeah, okay, so Louise and I can talk through that. So just when it comes to mental health and smoking, what I would say that all of those newly commissioned services, we use an equitable lens, and we've been, we have some targeted areas that we do, low level mental health in particular is one of them. So we're sort of working through the pilots for that, and also the Smoke Free app has just done a little bit of evaluation, and there's some information around that where it's being supported by more people with low level mental health like to use the app because it's sort of there in their pocket and they don't have to necessarily engage with people face to face. What else do we also know? We have it as a priority within our Everyone Health service. So actually on their website, it will say that we also would help and support people with low level mental health in particular around that. Louise, do you want to say anything else?
I was going to say that our Everyone Health service, which is a specialist service provider, it's available to people aged 18 plus who are diagnosed with severe mental ill health, including but not exclusively schizophrenia, bipolar disorder and manic depression. So it's really good that we have this in our local service provider.
Just to add, as well as the services themselves, which are a really important part of the jigsaw, just reflecting back on what Mark said at the start in his update on Priority 1 about how the Health and Wellbeing Board strategy and the Health and Care Plan link together, and joint metrics. So this is not a metric for public health or the council or the ICB, but jointly. So again, we should hopefully be able to see some changes to that prevalence level for smoking and that equity lens of mental health. But those joint metrics, as Mark said perfectly earlier, are really important to us.
I think we shouldn't kid ourselves that this is an easy one to resolve. I mean, I worked in the field of smoking cessation for 7 years, and it was a very tough nut to crack, that particular issue. The question that I had was that wiggly line. I'm always suspicious where you get a line that's kind of all over the place. Is there something about the way that we gather the data that has created that, or is it just that sometimes it's better than others?
I think it's probably an artifact of just maths overall. So when you're comparing with the London or the England data, it's pure like large numbers that would show you a more even trend, whereas with smaller numbers, although we're talking 23,000 people in Merton, actually the variance in that data as it goes through in the collection each year is going to show a lot more variance as you go through.
Thank you.
But the trend is downwards, and that's what we really like to see.
Jennifer.
Thank you, Chair. Just looking at the report, it doesn't seem to mention the rates of vaping. Sorry, it doesn't seem to. The report doesn't seem to mention vaping. Have I missed that?
So it's an interesting one. Vaping, it's very difficult because we promote vaping for adults to use as a harm reduction smoking, but we also look at trying to ensure that young people don't start vaping, and people that have never smoked as well don't take up vaping. So it's a very tricky one. I would have to go back and check on actual prevalence rates of vaping and if what data is available to share with it. But it's a little bit difficult because we're trying to, in some ways it's positive. We want to see people vaping as opposed to smoking, to use it to avoid tobacco products. Because the harm is in the tobacco and the tar, not in the nicotine. But we can get you some data, I'm sure.
Henry, and just to add to what Julie said, which is absolutely spot on, last week new ONS data was released on smoking and vaping, so obviously the papers were published before then, so we will send you the latest data on that, which is really interesting. It shows some interesting trends, but very in depth.
Say all the scientists that I worked with in my period in smoking cessation were absolutely united in the view that vaping is much less harmful than smoking because of the tars and the carbon dioxide and all the carcinogens within tobacco, which just aren't there in.
I believe it's quoted as over 90% more safe than cigarette smoking.
Yep.
But there is also this just dichotomy of ensuring that young people aren't taking up smoking and those that are vaping and that those that have never. So there's, we still don't know long-term situations on that. But yes, the evidence around the harm from cigarettes and tobacco is in the tar in particular.
Councillor Kwasi.
Thank you very much. I have quite a few questions, but some of them will be quicker to answer than others. And I'll be succinct in asking my questions. So my first one was around that 23,000 smokers number. Of that 23,000, what number accounts for those who are aged 25 and under? And if it's possible to have that number, that would be great. And picking up on Jennifer's point around vaping, whilst I agree it's a better alternative to smoking for adults, but for children and young people, it's a dangerous gateway into smoking. So it is quite the opposite. And we've sadly seen cases of school children vaping. I mean, I sometimes pass school children vaping and I always have to restrict myself from intervening. And yeah, there's a very worrying trend in children and especially school children vaping. And so I'm glad that a lot of the work that Catch 22 is doing is around going into schools and raising awareness of the dangers of vaping, because whilst it might be safer than smoking, there are all sorts of chemicals in those vapes that will present different harms to children and young people. And I wanted to pick up on a point in the report that's around a caseload of 10 children that Catch 22 had been working with on getting them off smoking. And it says in the report that the children engaged with the advice service, but then didn't sign up for the quit deadline or that pathway to completely quit smoking. And I was just curious as to what the next step is for children who or young people who engage with the beginning of that process of coming off smoking but then decide actually I'm not going to continue with it. is there an effort to get them back on the program, or is it, they just leave it there, which I hope is not the answer? And then if I may, just my last question here, which is around tackling obesity. In the previous report we looked at, it mentioned a case study that King's College London had done around fast food and our efforts to ban, fast food from delivering to schools or around schools, but how that doesn't include sort of advertising around those areas, and advertising is just as harmful in some ways because it's still encouraging people to go to go to those places and building those cravings for those places. So it actually doesn't really eliminate the desire for fast food. And so I'm just curious to know what you made of that study and what we're going to do about that. Thank you.
I think there might be a case for a bit of a meeting outside the meeting to discuss some of the issues, because I suspect that the answers to all of those questions would give rise to a conversation that possibly we couldn't conduct within the confines and the constraints that we're working to this evening. But I do think that many of the points you've raised are important ones, and I'm sure our colleagues would be willing to arrange a session with the focus specifically on children, and steps that can be taken and what the harms are. And I think that's, because reality is that throughout the history of tobacco and tobacco control, the tobacco industry has set its sights on young people, and because they need a good supply of people that they will harm and kill, basically, about smokers. And so I think a conversation would be useful. Russell, could you help set that up? Or
Yes, Chair, we welcome setting that up, and I've got a presentation that I can share with Councillor Gray. So in terms of, we signed up to a London position statement on youth vaping, which is very clear around prevention. For example, using clear public health messaging to explain why it's not appropriate for young people, stressing that it can be addictive, etc. Taking a whole person approach to health promotion. So it's all here in a London position statement. So we've been working across London with public health colleagues for some time to get this position statement agreed, which is now agreed. So I can share that as part of wider feedback. We can possibly meet with you as well. Yeah, to discuss this. Yeah.
thank you. Please.
Yeah, just a question on, do you have figures for how many people have taken up with the, I think I pronounced it correctly, Barron's decline, and the outcomes of that? So thank you. And just a quick point as well, noticed in the report that 6.18 is incorrect. The NHS fingertips data show 725 health checks were completed in this time, not 752. I think it might be a typo. Just thank you. Yeah, on that other question.
So I can just talk about varenicline very briefly. So varenicline, we don't currently have an agreed pathway for delivery of varenicline. So varenicline is a stop smoking medication. It was withdrawn. It's now become available, and as part of that process, we're working through an agreed pathway with the LMC and pharmacy and everyone else that's involved in that. A GP can still prescribe it themselves if they want to. But it's about making sure there's that ongoing 12-week support for that person as well, which most GP surgeries can't deliver themselves. And and so the provider. So at the moment, there's a limited amount of varenicline being prescribed across the borough, but we are working through it and having continued conversations about it. Add anything else to that? Okay. And I'll check the typo. Sorry, thank you for highlighting that.
Okay, so are there any more questions? Yes, Nicola. Yeah, please do. We're still just about on time, so
I'll be quick. So as Councillor Carissa said, 1,670 young people were reached by Catch-22 through the Kick the Cloud vaping workshops. Only 10 young people went on to reach that one-to-one support and none set quit dates. I wanted to ask, how were young people involved in the development of the workshops, and did they help monitor the engagement throughout to see if there's any ways that could have improved the engagement as well? And also, could this potentially be a training opportunity for young people to also deliver these workshops, as sometimes peer-to-peer engagement could be received better? And yeah, those are my questions. Thank you.
So I can answer a little bit of that. So Kick the Cloud was commissioned by Merton to be delivered and included Merton young people in the films and the development of that work. So they were absolutely key to that development of it and in the promoting of it. I think the Youth Parliament have helped to do it, and your own under 18s network has supported it as well. So yes, absolutely, it was about that. And then you just asked, what was the second part about So I can go back to Catch-22 and say, but I'm sure that they will have taken on board some of that information. And then your question about peer-to-peer support is one of the pieces of work that we're doing with Catch-22 as part of the what we've commissioned them to do, is to create smoke-free ambassadors, and that includes parents, carers, educators, but also peer-to-peer. So we're starting to do that process, and that's about doing the training, and so that they absolutely, yes, that there's peer support available.
Thank you. And just to add, around the funding that we've received from government are very much about delivering stop smoking quits. But for us in public health and across everyone in this room, I'm sure it was really important for us to talk with young people to stop them starting in the first place. So that's why that's part of this programme, and we need to get this balance correct with engaging young people to understand the harms of smoking, whilst at the same time delivering quits. So we've tried to get the balance right between the two, but absolutely that prevention is a really important message for us.
I just add something else about the youth smoking, is that according to GP data, there are actually only 285 registered smokers under 19 in the borough. So it's a very small number of people that we're trying to engage with at the same time. But there is a piece of work that we're doing about how do we still reach those people. And the young people that did engage with Catch-22, I think in nearly all cases, they were actually cannabis users, they were dual users. So that's one of the reasons they didn't engage with the stop smoking, because that's not really what they were using the tobacco for. They were using it for the use of cannabis. So it was a more complex situation than they're smoking cigarettes.
okay, well, thank you for that. And unless there are any other questions or comments, then I think what we're asked to do is to note the report, and we've been asked to comment on it as we've gone along, and we've had plenty of comment. So thank you for the presentation, thank you for the report, and it is noted. So item 9 is the maintain a multi-agency approach to tackling the harm caused by alcohol and other drugs, and it's Louise and Ted who are going to be presenting that.
Thank you. So this next paper continues the focus on prevention theme, and as Councillor McCabe said, it's outlining the actions being taken on preventing and tackling the physical, mental and societal harm caused by alcohol and other drugs. Action 3 of the strategy states to maintain a multi-agency approach to preventing and tackling the physical, mental and societal harm through delivering on the actions set out in the 24-25 annual public health report, Tackling Drugs Together. So Ted
who is our senior public health principal, will take you through this paper, which really focuses on prevention through an alcohol and drug lens, and it describes the really good work that is taking place with the Tackling Drugs Together partnership.
Thank you, Louise. I will endeavour to be as concise and clear as Julie, but I can't promise I'll succeed that. So I'm going to discuss how we're working in partnership to prevent alcohol and other drug problems. I'm going to briefly touch on the background, but very lightly I'm going to mainly focus on the achievements that we've made against the recommendations that are set out in the Tackling Drugs Together report. So just giving you a quick reminder of why we focus on preventing alcohol and other drug problems. Alcohol and other drugs are a significant driver of poor health, plus they have wider societal impacts such as accidents, increased crime, antisocial behaviour, and things like neglect. In section 4 of the report, section 4.5 sets out some of the information that was provided in Tackling Drugs Together partnership report, including the financial impact on both the UK and Merton from alcohol and other drug use. And then it goes on to list some of the societal impacts, such as domestic abuse and neglect. Section 5 of the report covers some of the conceptual frameworks around prevention. These frameworks were considered when we were producing the rest of the report and when we were assessing our actions against the recommendations of the Tackling Drugs Together report. Before jumping in to have a look at the recommendations and how we're working to achieve those, it's useful just to quickly touch on the Tackling Drugs Together partnership. The Tackling Drugs Together partnership is the Merton's what's called nationally a combating drugs partnership. We've purposefully focused it to look at alcohol as well. It provides strategic governance to all the work that is happening around alcohol and other drugs in Merton. One of the action plans, probably the most notable action plan that underpins the work of the Tackling Drugs Together partnership, is the Tackling Drugs Together report, which I'll go on to discuss in a second. There are 15 recommendations in the report, so I don't propose that I go through those in any sort of depth, but I'm going to pick out some highlights and draw your attention to some things that I think we've been very successful with, but happy to take questions on any of the content against those recommendations. So the first recommendation is around increased data sharing. Data is obviously important for the Tackling Drugs Together partnership and underpins all the work that we do to tackle alcohol and other drugs. You're going to hear about it more later, but the development of the Lived Experience Forum has been excellent at providing additional really rich qualitative data into the work that we're doing around alcohol and other drugs, really helping us understand from that lived experience perspective. Recommendation 2 is around enhancing and increasing the effectiveness of recognition and response to alcohol and other drug problems, and it's here that we can really reach out to partners and kind of seek help in improving this. You know, the recognition and response of these problems is something that could be done across the board, across all partnerships really. We've been delivering some harm reduction campaigns, and we continue to do those across the year, promoting harm reduction messaging around alcohol and other drug use. We deliver various alcohol IVAs in various settings. There's some information around the numbers that were delivered in NHS health checks, and the community grants program has been proved to be a really good way of kind of getting grassroots recognition and response to particularly alcohol use in the borough. Recommendation 3 is around maintaining resources. The resources that we have within the council now are at a really adequate level. And the partnership forums such as the Treatment and Recovery Group and the Drug and Alcohol Related Death Panel and the Tackling Drugs Together partnership itself are now really well developed and really effective and really robust. Recommendation 4 is around harm reduction activity. There's training, regular training that goes on through VIA around harm reduction. We've got a naloxone distribution scheme, which is really well embedded now, which is naloxone is the opiate overdose medication. We also hold naloxone in 16 of our community pharmacies for use in an emergency, and we have a needle exchange program that runs out of 4 of our pharmacies. So all of that combined is, it's a very effective response to harm reduction. Increasing our numbers in treatment is important. As we saw earlier in the data, our numbers have been relatively flat for a little while, but we are taking action. In response to that, we've got an open access service now, so you can walk into our adult service on various days and be seen within a few hours at most. And we've introduced a rapid access to opiate substitution treatment for things like methadone, so you can get that the same day now, I think, but that's certainly a very sped up process with the view to getting people into treatment as quickly as possible. From a young person's perspective, we continue to take the services out to young people and meet them where they're at rather than trying to get them into the service. And we're doing work to engage discrete groups such as LGBTQI+, and with the development of the VIA building, we're hoping to run some groups specifically for women. Recommendation 6 is around maintaining a well-promoted and easily accessible program within the borough. We've got a very effective and well-established treatment system now. We are continually promoting it. There's always more we can do, but there's a list of all the activity that we've been doing over the year, including adverts on big screens during Wimbledon. So we're doing a lot of promotion of our services, but as I say, there's still more that we can do. We continue to push to maintain the important investment in drugs and alcohol, so we are continually kind of banging that drum to central government to make sure we maintain investment. We are developing our recovery support program. We've got the IPS program, which is individual placement support, which is a dedicated employment support scheme. Merton operate as the lead commissioner for 6 Southwest London boroughs, and we're starting to see some very positive job outcomes through that program. And via our local drug and alcohol adult service has developed a program of peer mentor support. So that's people who've gone through the service supporting their peers. Recommendation 9 looks at co-occurring mental health, drug and alcohol problems, something called COMAD. A key area of focus for us. It's a priority within both the Tackling Drugs Together partnership, but also the Merton Mental Health Partnership Board. And a key thing that we're doing there is we are setting up a subgroup to the Tackling Drugs Together partnership, which will specifically be looking in a partnership setting at the topic of COMAD and how we improve the delivery of joined up care. In relation to training, there's ongoing training through VIA. They will regularly be providing basic alcohol and drug training. There's some stats provided there about numbers of people that have attended that. We are also working all the time with our colleagues in ADA, so the Met Police drug focused program, and we delivered an anti-stigma event in March of 2025, and we've got one coming up. We've got another event coming up with ADA very soon. Recommendation 11 is around strengthening the voice, and as I said, you're going to hear more about the Lived Experience Forum, but it's amazing that we've got that off the ground, and is actually that Lived Experience Forum is a really important way of tackling stigma. And as you remember, quite some time ago now, we presented a paper to this board around drug and alcohol focused stigma. We continue to use a place-based approach to tackling the problems, and we've recently, Izzy and my other colleague Penny have made developed a really good relationship with our local pub watch members, so that's been really helpful. We continue to work with ADA. As I said, ADA provide an amazing raft of information for the Tackling Drugs Together partnership, and it'll be really excellent to build on that and look at how we can use that to deliver some more place-based targeted initiatives. We continue to develop and improve our practice around the delivery of drug and alcohol focused interventions. As a small team within the public health team, we're very linked into our sub-regional, regional and national networks. We continue to look at the research and best practice, and we draw on data from various different sources, including things like our drug-related death reviews and the lived experience forum. We manage our contracts in a very comprehensive and robust way. I've actually got to present at the next DPG on our approach to the management of the drug and alcohol contracts, and we have the public health quality assurance framework. So those are the kind of highlights. Yeah.
Thank you very much. Are there any questions? Nicola?
So I would like to ask a question on taking treatment to young people. So between Catch-22 and Via Merton, is there a clear transition pathway? Is there a peer buddy link so that young people continue to be engaged with the service and receive the help that they need where possible?
Yeah, so we're actually, we have a transition protocol between Via and Catch-22, which requires that anyone between the ages of 18 and 24 is their treatment pathway is jointly agreed between the two organisations. We are also looking at how, well, we're looking at the moment how we can maybe enhance that and create a bit more of a kind of ongoing, almost like separate 18 to 24 transitional treatment package around those individuals. But yes, so at the moment there is that process where if somebody enters, regardless of what service they enter, there is a process of jointly agreeing what their treatment's going to be going forward.
Do you want to say anything?
If there's no other questions, I was reading this paper earlier in preparation, and I was kind of reflecting on all of the actions in here have been taken in 12 months. Just 12 months we've delivered all these actions. So for me, it was a massive thank you to the team, Ted, Izzy, Penny, Louise as well, and all members of the public health team, but all the system. But all those actions, all that success is in just 12 months. So I just wanted to kind of share that reflection. I thought was outstanding.
Thank you. Any other questions? Well, we are asked once again to note and comment on this report, and Barry, you've certainly given us a very good positive comment at the end of it. So can we note the report and move on to item 10, which is the live experience and voice in public health, and that's going to be Louise, Izzy and Nicola.
Thank you. So one of the principles underlying the health and wellbeing strategy is listening and learning from experience. So that means engaging with communities and individuals with lived experiences, including young people, to shape the services that meet real needs. We heard from Julie's excellent paper earlier, the example of the work by Westco Communications, delivering that World Cafe event to understand the lived experience of people who smoke and develop a campaign that would resonate with other smokers to encourage them to take the next step in changing their behaviour. So this presentation outlines two further examples in more detail of the kinds of engagement work that we've been undertaking. Next slide. So the health and wellbeing strategy actions include taking a collaborative and systematic approach to insight and engagement, feeding the voices of groups with known health disparities into system-wide decision-making. And this is part of the next priority. So what Russell said earlier about a really good segue to the next issues. So the two examples we're presenting this evening demonstrate this effectively, and the benefits of doing so are really clear. So listening to people's lived experiences ensures that the services that we commission or provide are person-centred, equitable and responsive. If we really listen to what people tell us and act on that information, including feedback in a you said, we did approach, we're able to build trust with our communities. Focusing on addressing inequalities encourages inclusivity through engagement. It validates that people are the experts in their own lives and reveals the gaps or barriers that would not have been discovered otherwise. Through valuable insights, we can tailor services to practical needs and take a co-production approach. Next slide. So the two case studies we have to present this evening, the first focuses on the development of and outcomes from a drug and alcohol lived experience forum, which will be presented by Izzy Watson, project officer in the public health team. And then we'll follow on that straight away with Nicola De Silva, our young inspector, who will give an overview of the second case study, which involved engagement with young people on the Eat Well, Be Active action plan. Slide.
Thank you, Louise, for the introduction. So, as mentioned, I will be speaking to some slides that concern the development of the Drug and Alcohol Lived Experience Forum as a subgroup of Merton's Tackling Drugs Together partnership. So this aligns with OHID's recommendation to strengthen the voice of those with lived experience in drug and alcohol service delivery. The forum is for any resident of Merton who is 18 and over and has personal, current or historic lived experience of alcohol and other drug problems. I'll be sharing the outcomes, insights and application of our learning, both on how we deliver future forums and how we enhance our support offer for people experiencing alcohol and other drug problems locally. So I think this is the right slide. This slide outlines the overarching outcomes public health would like to achieve from the implementation of this forum. Most notably, this includes making sure we reflect lived experience voice in our work to tackle the harms associated with alcohol and other drugs locally through getting feedback on the work we are producing and our treatment offer. A key secondary outcome of this and a focus of the 24-25 DPH report, which Ted mentioned, is tackling drug and alcohol related stigma by giving those with lived experience a seat at the table and ensuring their comments inform our work. Next slide, please. So we delivered our first forum in October, which was a really positive experience, but also presented some opportunities for learning. So we had around 40 people attending the first forum, with at least 2/3 of attendees being men, and the majority of attendees' first language was not English. We discuss access to our local drug and alcohol treatment service and access and experience of local mental health services. The insights we gathered were valuable, with recurrent themes arising in discussions. The key takeaway for us was the role of stigma, social isolation and loneliness as a barrier to engagement with drug, alcohol and mental health services, and the need for holistic support, advocacy, accessible information, assertive outreach and lived experience in the workforce as ways to support our target cohort in accessing support. Next slide, please. So I mentioned the successes just now, but also some of the challenges that holding our first forum presented. Key successes included interest from the community and hearing from an often stigmatized and underserved population group. I was proud that we prioritised taking an inclusive approach to ensuring we heard from residents from different demographies, presenting with a spectrum of drug, alcohol and other needs, like housing, for example, as well as engaging those who aren't currently accessing treatment, and that we were able to adapt our delivery on the night to suit the needs of these attendees. We did experience some challenges, particularly around translation, and there is still much more to do around access across the local drug and alcohol cohort, which we are taking forward. Next slide, please. So building on the previous slide, this shows how we have taken some of our learning forward.
We have a commitment to publishing insights from the forum on the council website in the interest of transparency, accountability, and to build trust with our communities. We're enhancing our work with community organisations who serve specific populations who would benefit from tailored harm reduction advice and greater engagement. We're also sharing relevant feedback with our local treatment provider VIA. We're also involving VIA more in the delivery of this group, giving peer mentors a leading role to support both their development and involving them in the decision-making process. We're also taking learning forward in how we deliver subgroups as part of our public mental health work too, by developing another subgroup that Ted touched on earlier of the Tackling Drugs Together partnership that will consist of professionals but review the needs of people experiencing co-occurring mental health, alcohol and other drug problems. We have also been engaging with previous attendees of the forum in volunteering opportunities as well. So I look forward to watching this forum develop and delivering the next one in December. So yeah, this concludes my part of the presentation and I would like to hand over to Nicola. Thank you.
Thank you, Izzy. So I'm going to be talking about our Eat Well and Be Active engagement with young people. So as you can see, oh, next slide, please. So as you can see here, this work was part of our Young Inspector Youth Voice work on eating well and our Being Active workshops as well. So we spoke to two groups, Ricards Lodge's Health and Wellbeing Reps and the Merton Youth Parliament, which took place during the summer term in 2025. And the aim was to explore what helps and stops young people from eating well and being active. So we ran group discussions and wrote the ideas on A3 sheets to ensure that it was engaging, and we also used prompt questions to spark conversation. And the feedback is now being used in the annual public health report, healthy weight workshops, and the Eat Well and Be Active action plan. And a few of the challenges were the quality of the audio recording during the Merton Youth Parliament session. So we tried to record the session, but unfortunately the microphone was too close to the receiver. So that's very useful for future sessions and workshops to know how to work the audio tech better. And unfortunately, I didn't keep a close eye on the clock, as Councillor McKay does. We couldn't explore all the sub-questions in depth, and some students were quieter or more hesitant to share their personal experiences. Next slide, please. So as you can see here, we group the findings into 4 key themes. So emotional and mental health, social and cultural influence, access and availability, and costs and financial considerations. I'm not going to read all of these points, but young people overall linked mood and motivation closely to food choices, and these showed that stress and anxiety also often make eating well harder, and friends and family and social media play huge roles, and they can encourage healthy habits but also add pressure. And also access and cost came up repeatedly throughout the findings, and limited healthy options at school and higher prices also played a huge impact. And so eating well isn't just about willpower, it's shaped how people feel, what's available, and what they can afford as well. Next slide, please. So again, the themes are the same, but these are the findings on being active. So motivation and support from family and friends play a huge role, and confidence and stress can also be barriers. And access to safe, nearby spaces really matter as well. Lighting and age restrictions and cost all play a huge part as well. And young people also mentioned affordable gyms and outdoor options as positives as well, which is great. And so being active does not only just depend on motivation, but feeling safe, supported, and being able to find affordable options as well. Next slide. So also, this project sits alongside other youth engagement work that you can see here. So the My Health Merton pilot looked at how GP services can meet young people's needs, and our vaping engagement informed new lesson plans, also now used by Catch 22, which have reached over 800 young people so far. And together these overall show how young people's voices are directly shaping local health actions and priorities. Thank you.
absolutely. That the question was around alcohol, drugs, and the link. That Southwest London and St George's also have their experience forum, and how make sure that we're benefiting each other from the different forums. That makes sense.
Yeah, it does. I think that sorry. Yeah, there's absolutely a need to look at how we share learnings between the two forums. As is touched on, one of the things we talked about in the first forum was access to mental health services, the experience from that group. I think that's probably something we'll go back to and touch on again. So yeah, I think if nothing else, I think there's maybe a need to kind of coordinate the topics that we're looking at, and we've thought about how we might bring other people into that space to kind of hear from the group and share their kind of expertise. So maybe that's something we could do with mental health, and maybe we could bring drug and alcohol services into that.
It's an offer to kind of help facilitate that crossover, the lived experience, people to inform kind of what each is doing, but how they might support each other.
Yeah, absolutely.
And just to add to that, clearly with the COMHAD, co-occurring mental health, alcohol and drugs subgroup of tackling drugs together is co-led by Southwest London, St George's and us in public health. So that is absolutely meshed together, and that lived experience will be part of that work, because we need to develop an action plan on exactly what we're going to do to make sure that our residents can access services without being bounced around between them. So that's absolutely led by the trust and ourselves in public health.
Slightly different point, but it's one that I made earlier in terms of this setting up for the stronger communities priority that Tony's going to speak on. And for me, listening to that, it was really testament of authentic community engagement, at the heart of authenticity with community engagement. So thank you.
Yes, I would just like to 100% endorse that, and to thank you both for the pieces of work that you've done, because I'm a huge believer in our services being led by those that they're meant to serve, and this work absolutely speaks to that, and it's something that we prioritize and are well regarded for in children's, and I'm glad that that's a practice that we're doing across the board. And just to stress that when we do these engagements, let's ensure we're always practicing the "you said we did" approach. So when people trust us with their experiences and their input, we go back to them and let them know what that's amounted to. So they know that their engagements are in fact meaningful, and it helps build trust between our residents and these institutions, where unfortunately for some residents there is that barrier. But the more we show that their input is shaping the services that they receive, the more those services will meet their needs, and we'll build that much stronger community we all want. So thank you very much for being on track to take us to that promised land.
Izzy wants to respond, I think.
Thank you, Chair. I was just going to say in response to that, I really would agree with your comments, and that is a big reason why we've committed to publishing the insights on the council website in the interest of transparency and building that trust with our communities, because I could completely understand what you're saying. Thank you.
just like to add to that as well that as well as we as statutory organisations engaging in that dialogue and communication, some of the benefits that we're really getting, of course, is the community grants approach as well, where we have that co-production technique of experts in local communities reaching out and doing that engagement for us and with us as well. So we're coming at it from a number of different angles, which I think is really valuable.
Okay. I appreciate the comments about being obsessed with time, but there is a really important aspect to it, which is that people who are presenting, as you were, at the end of a meeting, actually need to be given time and respect by the rest of us. So we have to be disciplined. So I make no apologies for my obsession. Jennifer.
Thank you, Chair. Just an observation from the comments that you were talking about. Particularly, you said on the Alcohol and Drug Abuse Forum, the attendance, 40 attendants, many were men, not women. I was just wondering whether you've considered with the engagement doing a men's, women, boys, girls separate, because we know that the drugs, the alcohol affects people differently, the reason they take them, different for men, women. They may not want to be talking about those in front of men, women, vice versa, and the same with boys and girls with activity or eating, mental health issues. So yeah, the suggestion would be to try doing men's, women's, boys, girls support engagement. Thank you.
Thank you. Yeah, I can definitely speak to that. So I'm not sure if I mentioned this was the first forum we did. So it was definitely a development process. And because we used an open access model where people didn't need to let us know if they were coming, we were not sure who was going to turn up or how many people were going to turn up on the night, but we did put mitigations in place to sort of account for all eventualities. And from the insights that I shared, it's clear that not enough women came to that forum. And in our planning process, I had made a note and had brought it to SLT that in the future, once the forum is more part of business as usual and functioning seamlessly, that a women's only forum would be a good thing to take forward, because I completely take your comment on board and note that women in particular are disproportionately represented in our drug and alcohol related death data. So see the importance of that for sure, and is something that we're thinking about and taking forward. Thank you.
So now we come on to and sort of refer to the fact that this actually linked really well with the last item on the agenda, which is strong communities highlights in preparation for the next meeting. And Tony, you're going to speak briefly on that.
Thank you, Chair. This is a brief curtain raiser, Pearl and Dean style, ahead of the third strand of the health.
Do the music?
You can't do the music. Do the James Bond walk on bit. Ahead of the third strand of the health and wellbeing strategy, strong communities, for the themed meeting in January. There will be substantive updates coming to the board meeting in January. Any questions today will be noted and responded to as part of that meeting. There are 6 key actions really. The first one relates to engagement, and we will look to map current mechanisms to support engagement exchange between the voluntary community sector, seldom heard voices, people with lived experience and decision makers across the system to ensure we have a systematic approach that enables real-time insight, effect and needs into decision making. And currently we're progressing with this well. There will be a small steering group meeting convened in November to plan out the workshop with a wider voluntary sector to gather collective views and map mechanisms to ensure a more systematic approach. Merton Connected will host the workshop, I'm pleased to say, with support from our colleagues. The second action relates to capacity. We will explore opportunities to build capacity within the voluntary sector to support evaluation and use data to build robust Merton evidence base of health and wellbeing outcomes for different population groups through future commissioning and other routes. There's a slight delay with this project, but we're putting measures in to get everything back on track. Currently, we're looking at, or the group is looking at, the potential of using a plinth system for wider data collection, and we'll explore opportunities for the voluntary sector organisations to report data-related health linked to the joint strategic needs analysis as part of the design for grants programmes, including the next iteration of Civic Pride Fund. Action 3 aligns to funding. We will undertake work to ensure the voluntary sector grant funding is aligned with Merton's strategic priorities, including those outlined in the new health and wellbeing strategy, in particular to ensure a collaborative effort for targeted interventions and projects to reduce health inequalities. This is progressing well. A Merton Grant Council review is currently being scoped. One of the key aims of this is to ensure alignment with Merton's strategic priorities. Exploring opportunities for partnership working between voluntary service organisations is essential and really important, including the smaller organisations which are a big part of our borough and will perform and play a big part in the design of future grants. It's interesting that we have probably about 400 small organisations, and they respond to things brilliantly and quickly. Action 4, upskilling residents through Civic Pride and Community Climate Action Funds. This is to support the community-led initiatives which help upskill residents through Civic Pride and Community Action Climate Funds. In 2023, the Cabinet allocated £500,000 or £666,000 per year for Community Action Fund to support community-led climate mitigation and or adaptation projects in Merton. The fund is running in parallel with Merton's annual Civic Pride Investing in Neighbourhoods Fund. The second round of Merton's Civic Climate Action Fund launched in autumn 24 alongside Civic Pride Investing in Neighbourhoods. Funding was allocated from a combination of these two funds to support 23 projects. Bidders for both projects included Ethnic Minority Centre, Muslim Women of Merton, Polish Families Association, Parents Bereaved by Suicide, Friends of Park groups were also numerous. In terms of looking at projects where upskilling was involved, there was the Merton Garden Streets, Friends of Moston Gardens, Herbs and Roots Climate Hub, Saving Energy, General Climate Awareness, and Learn English Together. The third round of Community Climate Action Fund was launched alongside Civic Pride Investing in Neighbourhood Funds on the 8th of September 25. Bidding closes tomorrow. I can say from our perspective, the Neighbourhood Fund, we've got upwards of 25 applications, which is good, quite exciting. And as the project's rolled on, it's also interesting to see new partners have come to it. So it's not the same faces. So I was quite interested to see, I'm quite anxious to see what people have put down. It's always interesting. Longer term funding, we're going to consider the opportunities to explore longer term funding to establish and maintain community trust, maximise influence and participation, as well as part of the review of Merton's approach to the voluntary sector. This is progressing well. Merton's core Civic Pride supporting the VCS programme is currently commissioned on a 3-year cycle. As part of a forthcoming review of grants, this will be benchmarked against other funders. Previous rounds of Merton Giving Civic Pride small grants funds have been run over a 6-month period. However, future funding will look to longer term to allow greater stability to the sector, which I think is important. Just carried out a large survey at Merton Connected, and we found there's no surprises really, but long-term funding is becoming more and more of an issue. People are struggling on lesser funding, or short-term funding. And on to action 6, which is Health and Wellbeing Board Celebration. Not a celebrating type, but we'll see. Established an annual Health and Wellbeing Board celebration showcasing the diversity of local action, contributing to the health and wellbeing strategy. including an opportunity to shape the forthcoming year's priorities. This is progressing well. The Merton Partnership will be hosting its biannual summit during the summer of 26. Outlined proposals will be submitted to the Merton Partnership Board on the 25th of November. An update on the health and wellbeing strategy and the role of the wider partnership in supporting this will also be taken at the same meeting. What we're asking really for today is to gain agreement from the chair and members of this committee on the papers to be tabled at the meeting in January. So the detailed papers we would like to bring is around Action 1, engagement, map out current mechanisms to support engagement exchange between the voluntary sector, seldom heard voices, people with lived experience and decision making. Around Actions 3 and 5, aligning funding and longer term funding to align the voluntary sector grant funding with Merton's strategic priorities and to explore longer term funding. Action 4, upskilling residents. Support community-led initiatives which will upskill residents through the Civic Pride and Community Climate Action Fund. And there will be briefer verbal updates on Action Point 2, capacity, exploring opportunities to build the capacity within the voluntary sector to support evaluation and to build a Merton evidence base. And Action 6, the health and wellbeing celebration, an event linked to wider activities of the Merton Partnership. Thank you.
Thank you, Tony. Are there any questions, comments? Well, we look forward to that. I think there is a general consensus about what you are proposing. So unless there are any questions, I will bring the meeting to a close. And thank you all for your discipline. We are a minute over the allocated time. I apologise for that, but I think we've actually packed in an awful lot of work into that, and that has been helped by the quality of the presentations and the work, the preparatory work that's clearly gone in from colleagues right across the areas that we've looked at tonight. So thank you all, and have a safe journey home, and we will be back again looking at what Tony's just described in the very near future. Thank you.